Well, the number of COVID-19 cases has risen by more than 900, bringing the total number to 16,433 at the moment. The Western Cape, still the province with the highest number of infections, with above 10,000 cases. It also has the highest death toll. Northern Cape and Mpumalanga are the only two provinces still that haven't recorded a COVID-19 related death. Let's discuss these latest figures with Professor Adrian Puren from the National Institute for Communicable Diseases. Prof, a very good morning to you. And let's look at what we have in front of us today. We're looking at these figures, and we have, yes, another increase, and we've spoken about, basically how we break those down, when those tests were done, and how much later we're seeing them. Let's get a little more specific, if we can. And I was looking the other day at a breakdown of just infections when it comes to age and gender. Now, you've seen that breakdown as well. What have you noticed where we once only thought that this is something that would affect the very elderly? We're also seeing that there are a number of young people as well who are dying from COVID-19.
So I just want to build up from what we discussed yesterday. So there's quite a leap from children. In other words, if you look at the 19-year-olds or 20-year-olds up to the age of about 60, you can see that the risk of infection, or the risk rate, that's per 100,000, is about 30 or thereabouts. And then there's a slight drop-off from the age of 60 and onwards to about risk of about 20. So there's still a range of risk, and that we can't ignore, especially in the younger age groups as well, because that's the age groups that are people who are working. But even in the age of 60 and above, those are individuals that are economically active as well. And if you look at the gender distribution, and again, if you look at the gender distribution between, say, 19 to 49, women are at great risk of infection. But this changes as you look above the age of 60 or thereabouts. You can certainly see that the risk in men certainly is much higher than it is in women. And in fact, when you relate that back to mortality, as you know, that men have a greater mortality. It's higher in males than in females. I think the other interesting thing at the moment, we don't have rates at this time, but if you look at the rates of or the numbers of deaths in, as you mentioned, in the Western Cape, for example, you can certainly see that deaths are certainly obvious in younger age groups in the Western Cape versus the national data. So I think those are of concern, and I think we spoke about risks. We spoke about not just the comorbidities, also about HIV and TB that can affect our communities.
Now, I'm also looking...
I think the other comment I could add, apologies for interjecting, is also the Eastern Cape. So again, if you look at the Eastern Cape, again, there's discussion around clusters and what are those clusters about and what is actually happening there. So the Eastern Cape is certainly contributing more cases than we've seen previously. So that's also of concern.
And just looking at areas like Northern Cape and Mpumalanga, what possible explanation could we have that, that the only two provinces that haven't recorded a death when it comes to COVID-19, we're looking at their low numbers as well. Is it that possibly not enough testing is being done there, or not enough attention is being paid to this pandemic in those provinces? What possibly could be happening there?
Well, they probably had a low influx of cases, or influx is not the right word. So in terms of transmission within those particular areas, there may well be low rates of transmission, but you're quite right. It's really critical then to keep an eye out what's actually happening. Again, given the limitations around testing, we should be focusing on hotspots, for example. My view, and I've emphasized this repeatedly, is that it's not just in Mpumalanga where testing may be low. It's in fact in particular areas like the Eastern Cape, for example, where you're seeing the rates of testing are not as they should be. They should probably be higher in terms of trying to identify cases. In fact, should be higher than what we're actually seeing in the Western Cape in order to really get a good sense of what's actually happening in these areas. I think, again, it's really emphasizing around strategic testing really becomes critical now.
Well, it is the 19th of May, Prof, and we had the President tell us last week that come the end of May, we'll be looking again at these lockdown regulations. There possibly will be some easing in many parts as well. He also suggested much earlier than that the time will come where we'll have to look at different provinces, different districts as well, where maybe you have to look at different regulations, different rules for different places, depending on how hard they've been hit. And just looking at the numbers as we see them today, would you say that that would be a good idea?
Yes, I think a nuanced approach, an approach that's at the local level, I think is really important. And what is important is to link that with your data. So if you have your testing data, you are naught, and you look at your preparedness, and I think that's the concern in the Eastern Cape, for example, is the level of preparedness around your health facility. And I think those types of factors certainly play an important role in making the decisions around whether or not you can go through a much more rapid and speedier lockdown versus an area where you have hotspots, where you really need to focus on your health facilities in order to ensure their readiness, and therefore have a slower release around that. That may not appeal to everybody in terms of the economic hardships that we're going through, but I think we really need to balance that binary between what's happening on our health systems, our communities, and the economy.
All right, we'll leave it there for today. Thanks very much, Prof. Adrian Puren from the NICD, just looking at what the figures we see them as of this morning, what story they're telling us at the moment about what's happening in our country.